For the moment, if you put yourself on mute, and then happy for you to interact either by unmuting or placing a quick question in the little bubble on the right of your screen, and I'll be monitoring that. So Kirsty, you can start the recording if that's okay. I can see you have. On the panel today, we have Jane McLeod. I think many of you might know Jane already. She's a GP in our region and is also our clinical editor for Health Pathways, and soon to be launched our out-of-home care updated health pathway. She's also a medical educator for the Black Dog Institute and for GPTQ. She's recently been offered, I'm happy to announce, a position as a GP with special interest in pediatrics at Ipswich Hospital. She's also worked and lives in remote Aboriginal communities in Queensland and Northern Territory, and has worked in Indigenous health in urban settings. And amidst all of that, Jane also has 3 children, so very good. We've also got April Turner, who's from Brisbane South PHN State Program Coordinator for the Strengthening Health Pathways for Children and Young People in Care project. April also comes with knowledge of Department of Health reform agenda for mental health, and she's passionate about consumer and carer participation and bringing people together to create system change. So I'd like to welcome Jane and April. We did have Rachel Brown that was meant to be on our panel from Department of Child Safety, Youth and Women, but unfortunately she's had something urgent come up. So I might just start by asking April to provide some key messages and learning from her respective roles on this incredibly vulnerable group of young people that we deal with in general practice.
Hi everyone. We've been funded by the Department of Child Safety now for just two years to do this work across the state, and the key objective is to improve the health outcomes of children and young people in care, and by doing that ensuring that children coming into care have access to high quality and timely health assessments and annual assessments from there on forward. And also to support those that are working with children in care around the knowledge of their health needs, whether that be primary care specialists or the broader child safety and child protection system itself. So the other key objective is supporting the integration between primary care and health providers and the child protection system. So we've been working on that across the state, and that's where this webinar, I guess, comes into play. I'm happy to take any questions throughout regarding the project specifically, as some sites are further ahead than Darling Downs Westmoreland PHN region due to the staggered implementation.
And I suppose, thanks April, thanks for that. And I assume that everybody knows me, but I'm Tanusha Ramalu and I'm the GP Liaison Officer for Westmoreland. I work at the PHN, the Darling Downs and Westmoreland PHN, but also at Westmoreland Hospital and Health Service. I work across both those areas. So I might just hand over to Jane now to start with the presentation. And again, if you have any questions, just unmute or put it into chat, and I'll be monitoring that as we go through the presentation. Thanks, Jane.
Thanks, Tanusha, and thanks, April. So please interrupt me at any point for anyone on the panel, but also anyone who wants to ask questions, do so as well. I also want to acknowledge elders past and present and the traditional owners of our country. So just to remind people, when we're talking about young people living in out-of-home care, we're talking about people for whatever reason are no longer living with their family of origin, and they're now in a shorter or long-term placement. And that might be in a home situation, either kinship care, foster care, or other sorts of family homes, or residential care, or other forms of independent living. I'm not sure if you can see the whole screen. So when we're looking at the health needs of these young people, it's complex and it's comprehensive. So there may have been things that have been missed in their health history or their medical care so far, and the health assessments are a great opportunity to address those things. So we're looking at young people who have got emotional or mental health needs from either trauma or attachment issues. They might have either emotional dysregulation, mood disorders, self-harm, suicidality. They might be taking risks or have risk-taking behaviour, and they may be at risk of harm, either from their own activities or sexually. There's always the risk of harm potentially when they're in care, and there's always the risk of exploitation by others. It's important to consider the developmental impact that these kids have potentially gone through because of their early childhood, and also to consider if there's any developmental issues that we need to consider. In terms of their physical health, there may be vaccinations that they have missed, or they may be eligible for additional vaccinations based on their Indigenous status. They might have hearing or visual issues that have not been diagnosed, and there may be acute issues, illness or injury, or chronic medical conditions, or dental issues, nutritional issues, or growth problems. So there's a lot of things we can consider. Sometimes these kids and young people have disengaged from school or are attending infrequently. They might have behavioural issues at school, social issues at school, and they might be struggling academically. So the benefit of having a project like this, which is now rolling out, is we can see these young people and we can do a comprehensive health assessment, and hopefully that gives us the opportunity to work on early intervention, be that for medical problems, mental health care problems, developmental issues, and their educational needs. When we're working with these kids, it's important to have a trauma-informed or trauma-sensitive approach, and to engage them in trauma-informed mental health care, which Tanusha will talk about a bit later on, because there's funding and resources through the PHN for these young people to access such help. This might actually be the first time these young people have actually had somebody actually show them care and wrap them up in support. So lots of these young people will be very, very open to the care that we're offering them. And GPs, we're doing this all the time. So this is part of what we normally do as a comprehensive health assessment, very much like what we do for our 75+ health assessments, our health assessments for Aboriginal and Torres Strait Islander people. So we're looking at a really thorough, comprehensive health assessment where we're considering all aspects of the child or young person's need. So emotional needs, physical needs, social needs, developmental and educational. So it's sort of gathering that information and trying to pull it all together and then referring them appropriately. So for me, I wanted to get my head around the steps involved, because initially it seemed complicated to me and I didn't want complexity to turn me or other GPs off. So I just came up with some basic steps, and I'll go through them one at a time. And same thing, interrupt at any point. And also anyone on the panel, let me know if you've got input or other ideas. Tanusha, I can see that there's 5 comments in the chat box, but I can't open them and concentrate at the same time. So I don't know if you can see them. Anyway, so the first point would be, what would we do before a young person comes to see us? So all of us may potentially have a young person who is in care come and see us as a patient. And if we're interested in that, then let Tanusha know and become involved in the group who is working on this project. But irrespective, if you don't have the time for that, then it is worth having a look a little bit about what's involved. So there's a health pathway currently on our health pathways that is based on the Brisbane South model, but the Westmoreton one specific is not too far about being uploaded. There's templates that are available that can guide people through doing the 2 types of health assessments. We don't have to use the templates, so they're comprehensive and they give us an idea of what's required, and you can fill them in as you go. But if it doesn't gel with you, you don't have to use a template. You can use what you normally use in terms of doing a thorough health assessment, and that could be just doing it and using your normal medical software, or developing something yourself based on the health assessments we do for other population groups. If you do want assistance uploading those templates, then you can get in touch with the PHN, and their primary care liaison officer can help the practice do that. Tanusha, who introduced us today, who's the GP liaison officer, can also provide assistance to give some guidance about what is required. Or if you hear that somebody's made an appointment, or if somebody has turned up and you're not sure what to do, then I would recommend in the first instance opening up the health pathway, because there is some direction there, and it's thorough direction, or getting in touch with either Tanusha or the department if need be. So in case people haven't heard of health pathways, so this has got the website where you can access it. And basically you log in, and it's got the username and password I've listed there, but it's easy to remember. So WM Westmorton user, WM Westmorton password. And then once you've logged in, then I've not got it there, sorry, but there's a search bar where you can put in whatever pathway you're looking for. And it works really well. So I might put in, I tend to just write child care or child risk, and this one comes up. But so you can either search, or you can go down to the table of contents and find relevant pathways. So in this situation, you'd go to child and youth health, I think, and scroll down and find a relevant subheading, which I think is abuse and neglect, but not sure, and then you'd click and find it. So it's the same as for any health pathway. If I wanted to look at the asthma one, if I wanted to look at a diabetes one, I write in the search bar and it will pull up a list of pathways, and I click into the relevant one.
And Jane, you're right, it's under abuse and children at risk.
Yep. So the next thing I thought would be important is to have a framework for front staff if somebody rings to make an appointment for this young person. So it may be a carer who rings to make an appointment, or it might be somebody from the department, like the child safety officer for that young person who rings. So I would suggest that these young people would always benefit from a long appointment. It would be useful if the carer brought in their own ID, so we know who they are, documentation of the authority to care. So that's a legal letter that basically says that this young person is under the care of the department, and the name of the individual carer, if that's the situation, or the care organisation. There may also be other information that might be useful, so details of custody or guardianship, but the main thing that it would be great to have is that authority to care documentation, so you know that this child is in care. If they can bring the child's Medicare card, that's great. If they can bring the child health passport, which is a documentation from child safety where medical records are collected together, and if they've got any other medical documentation. Sometimes people do. Sometimes there's very little information that the carers have got in a paper form. But we know there's a potential that we can access their health record through My Health Record, and also get onto the Queensland Health portal, and we might be able to see some medical information there as well. Also, before they come, it would be great if we had the name of their child safety officer and the contact details. And that can be recorded in the details. If this is a new patient or there's changes to an existing patient, those details can go into the contact details for the young person in Medical Director or Best Practice or whatever software people are using, but also into the appointment software that people are using. So we know who to contact, who the carer is or the care organisation, and who the child safety officer is. So that's just a dummy of what an authority to care letter looks like. And previously when I've seen people, I've basically asked them if they've got documentation, and they tend to pull up an email with this linked or a photo of this, so I know what's going on, and I just ask them to send it to our practice, and then we print it and upload it onto their record. So before the young person is actually seen by either a health worker or a practice nurse or a GP, then I think medico-legally it's worth having a look at that authority to care so you know what you're doing is correct medico-legally. I tend to write in the warning section on the software that this is a young person in care. People might do things in another way. It's just that I know when I open the screen, it's there sitting in front of me. So I remember that there might be other needs that this child or young person has, and that there may be other implications in terms of decision making that I might not always consider routinely. It's important to have the details of the carer and the CSO in the contact details, as opposed to the family of origin's details as first line of contact. Because at this point, the guardian for this young person will be the department. Like all of our patients, it's important to ask the young person or the carer if the young person is Aboriginal or Torres Strait Islander or both, and record it appropriately. And if you've got access to viewing any of the medical information, it's useful to do so if you can before you see the young person, because it's challenging if you're reading about abuse or neglect or things that you don't potentially want to discuss with or in front of the young person in a first consult, or perhaps ever, to avoid re-traumatizing them. So if you can gather some information beforehand, great. Otherwise, do what we normally do, which is do things sensitively. So in terms of health assessments, it's what we normally do. So it's a comprehensive health check. We're looking at the young person sitting in front of us and considering the acute problem. So whatever is going on at the moment and whatever else is going on. So we do what we would usually do, but child safety has set terms for different types of assessments. So I'll use those terms and you'll see them on the following slides. There's just bits of information that they're particularly looking for. It's important to not freak out because it seems like a big thing. And if by chance your young person has been booked a short appointment or there's acute things going on, they've come in and it'd be great to do their preliminary health assessment, but currently they're unwell with gastro. So your priority is going to be the acute presentation, and you can start filling in the information or collecting information for a preliminary health assessment, but it does not have to be done all on that one consult. So if you can do it, fantastic, but don't get overwhelmed. So if you're not getting there, then just get the young person and the carer back again and continue on. You don't have to do all the work for this assessment. So like other types of health assessments, the young person can be booked in either with a practice nurse or a health worker prior, and some of the information and some of the assessment can be completed prior to you seeing them. And that might help with time management and the flow of things. And different practices will do things in a different way. So as I said before, there's templates that are available that you can download, and PHN can help you with that. Alternatively, if you look in Health Pathways, then there are links to both of those assessments which you can click on, and it takes you to Queensland Children's Hospital website. And as you scroll down, you have to log in, so you have to put your details, your name, and I think your email, I can't remember, and you have to click that you're a GP or another health worker. And then it has the templates available for downloading, and then the templates available on PDF. If you have any worries whatsoever, then what I would do in the first instance is I would have a look at Health Pathways and have a read through. If it still doesn't make sense, then get in touch with either Tanusha or the department. But it is a pretty systematic approach, so it really is not outside the scope of what we do normally anyway. The only things that I have struggled with previously and that other GPs might struggle with is working out who is who in terms of decision making for various things. So we can either discuss that now, or as we come across things, either, I'm not sure if that would be you, Elise, who'd give us some ideas, or April, about what GPs need to be aware of.
So Jane, I suppose those exactly what you've just highlighted, things like consent and sharing of information that is not normal general practice, something that we would consider within the legal framework, is all provided on Health Pathways. but there's also some really good resources that we will be sharing around decision making. There's a frequently asked document, and there's also a website. April's put it into the chat. And also she's also said that the purpose of the putting in your email to CHQ to get those templates is to ensure that you're getting the most up-to-date templates, because those templates can change. And April's also said that you know, a similar process as Jane, you said, to a 715, for example, is probably the best approach to understand the approach you need to take with these children, because we already know that they are definitely coming from trauma, abuse, neglect, significant medical issues. So it's how do we identify them and then put an early intervention plan in place. I think, Jane, I also just want to, what I've learned being on the project is that a lot of these children end up in that assessment stage and obviously getting acute care when they need it, but really don't progress that early intervention space, which is where we really want them to be to improve the health outcomes. I thought I'd just add that, but yeah.
Thanks.
So Health Pathways is a great resource for understanding those nuances that I think we as GPs may not be familiar with.
Thank you. So the preliminary health assessment, so ideally it'd be great to have that done within 30 days of a young person coming into out-of-home care. And the carer will know that, and the child safety officer will know that. So they will be the ones encouraging the carer or helping the carer make an appointment with their GP. So we start the process, and you can either use the template that you've downloaded or use whatever format works for you that is a comprehensive approach, looking at physical health, emotional health, social well-being, developmental health, what we normally do for one of our big health checks. So do your medical history like you usually would. Oops. Check your immunisation status and see whether this child needs to catch up on any vaccinations, and see whether this child or young person is eligible for additional ones. So we know there's been changes to immunisation schedules about a month ago, where there's changes particularly for Aboriginal and Torres Strait Islander children with regards to pneumococcal vaccination, Hep A vaccination, and something else, I can't remember. But the immunisation and health pathway for the region is live currently, and that does include those new changes. Perform your physical examination like you usually would. If appropriate and you think there's a mood disorder or a mental illness, perform a mental state examination like we normally do. If you think investigations are necessary, do them. If you think referrals are necessary, do them. This is where we really want to try and pull the information together. And like Tanusha said, if there is opportunity for early intervention for any of those things, medical issues, developmental issues, mental health issues, even academic or schooling issues, this is the time to act. So even when you're gathering this information, if something red flags with you, then start the process of referrals right now. And if you're not sure where to go in terms of referral pathways, then get in touch with Tanusha and she can help you with directions to mobilise that. If the child has got a My Health record, and my understanding is that these children will have My Health records, then upload your health check onto the My Health record and any other necessary documentation, and complete the documentation in the health passport, which the young person's carer will have with them. So I just want to remind you that that does not have to happen in one appointment. So that might be started in one appointment, and you might be having them come back for review to collect the other information or check results or check that referrals have been acted on or whatever you need to do. The other assessment is called a comprehensive health assessment. Oh, I've got to change the slide, sorry, Tanisha. And that has to be done ideally within 3 months, is that right? Yep, sorry.
Sorry, I did see that, and it was my mistake as well. I meant to change.
So it has to be done within 90 days, not 30 days, sorry. And once again, you can use a template. It's a very similar process to what you've done previously, but it's more comprehensive. So we know these children have potentially had very rough times, or they've not received the needs that they have, the needs that they should have, or the opportunities they should have to meet all their developmental needs. And they may have mental health or developmental issues because of that, or that have been missed for other reasons. So it's useful to use an age-appropriate screening tool to look at whether there are any developmental concerns. And I've listed a few of them, but there are links to these on the health pathways. So when you're going through health pathways, it's systematic, and you can basically have it open if you need, or go back and check to it. And as you get to comprehensive check, it will list these things and the age that they're appropriate for, and you can click on the link and it will take you there. If you're doing these all the time, then you might want to have these saved to your desktop or whatever works for you. Once again, recheck vaccination status in case they're due for something while they're there, and in case the catch-up process, it has not happened. So it gives us opportunity to work on any of the things that have not been addressed initially. Do what you normally do. So history taking, examination, investigations as needed, following up any initial referrals and seeing if there's action that needs to happen because of them. And if referrals have not resulted in appointments being made, see if you can follow up on that. And once again, upload the information onto the My Health record and then complete your documentation into the health passport. In terms of management, so as Tanusha said, our top priority is to address any issues that this young person has and to mobilise early intervention as soon as we can, because there are definitely positive outcomes for these young people if we organise early intervention and they have their needs met. Like all of the young people we see, ask them if they're Aboriginal and Torres Strait Islander. If they are, documented in your software. If that patient is going to be coming to your practice as a regular patient, then register for them for the Close the Gap scheme. If they're going to come to you as a regular patient, then see if they're due to have their Indigenous health assessment, their Medicare 715, and if so, arrange an appointment. If it's not due currently, so have a look on Proda and see when the next 715 is due and put them in the recall for this. And as I said previously, consider that additional immunisations that Aboriginal and Torres Strait Islander young people are eligible for and would benefit from. Do what we always do. So manage what is in the room. So we need to work out what the patient's agenda is. So the young person's agenda, the carer's agenda, if there's anything acute we need to manage right now, and chronic conditions. But always remind yourself, it's the early intervention that we really don't want to miss. We don't want to get caught up in that loop of sort of putting out fires all the time with acute crises or acute conditions and forget the fact that we're wanting to make things better for these young people and improve things for them in terms of emotional well-being and any developmental issues. Tanusha, can I get you to talk a little bit about the mental health opportunities in terms of mental health care for these young people?
Yep. So for any of you within Westmoreton and Darling Downs, we have a service map on our PHN, and I won't be able to go through every single service. However, there is the PHN funds an enormous number of services for complex mental health needs. They range from 21 sessions for mental health treatment plans that you've put in place. There's care coordination. There's low intensity. So if you think a child is at risk of anxiety or depression, there are services there. So literally, if you go onto our website, the PHN website, and look at our service map, you'll be able to access a large number of mental health services for our young people. And I think many, as we've said before, many of these children will require these treatments and management in place. And these are fully funded, so there's no gap either. And we try to ensure that there's access available in our different regions as well. So you literally, if you're in Ipswich, you click on Ipswich. If you're in Toowoomba, and all the services will come up.
And then in terms of development, if you've got developmental concerns and the child is under 8, I think, correct me if I'm wrong, Tanisha, then they're eligible for early intervention through EACH, which is the organisation that does it in Ipswich. I'm not sure who does it in Toowoomba, but there would be a similar organisation. And then the GP can refer, but the family or the department could also self-refer. But we're trying to have an approach that's sort of comprehensive and coordinated. So if you've got the time and the ability, then it is worth doing those referrals so the child can access allied health assessment and care. So at the moment, there's no item number specific for the health assessments of young people in care. So it's a time-based consult. But when they come back for their comprehensive assessment especially, then there is the potential that this could be done as a GP management plan, because the young person, just by nature of being in out-of-home care, would be eligible for consideration as being a chronic problem. So it could be worded as emotional dysregulation, or we will come up, I'm doing it off the top of my head, but definitely we would find adjustment disorder, thanks. So definitely there's scope for doing it, a GP management plan, so you would be remunerated for your time. And then if you are going to work with one or more other healthcare provider, then obviously if the child is eligible, you could do a team care arrangement as well. And the other person may actually be the child safety officer who'd be involved as part of the team. So if you do that process and you're doing your referrals through the TCA, then obviously you do your EPC referrals for allied health, or if they were under 8, then there is that opportunity to go through EACH to get the early intervention.
Jane, I think it's under 7, so it's 0 to
7.
Yep.
Excellent. Sorry, thanks. And then when you're working with these young people, try and pull it all together, because we want to keep providing them care over time and that continuity of care. So have a look, or get your front staff to have a look and see if they're due for Aboriginal and Torres Strait Islander health assessment. And if so, book them in when they're due. If they're eligible and it's appropriate, book them in for a GP management plan and team care arrangement. And that could be used as the management plan, which the department is hoping we can provide. If the child is eligible, do a GP mental health care plan. And as Tanisha said, PHN has funded mental health services for these young people, and there's no gap for these services. If it's appropriate, book for a case conference, and the comprehensive health assessment is repeated in 12 months. So when it's done, it's useful to put that in the recall system for yourself as a practice, but also we have the young person's contact details as the carer and the child support officer, so when the recall goes through, it means the department will be contacted to say that this health assessment is due for repeating. And I guess this just catches things in case that young person is no longer in the region and has changed regions. There's scope for continuing their care and having reminders to do so. And I've listed off some useful contacts. So I've got Tanisha's email there. Elise, who I think is online also, is the Senior Child Safety Support Officer for the region, and Kasha is a Senior Practitioner. So I might throw it open to the rest of the panel or the room to see if anyone's got any questions or wants to contribute.
I wonder if anyone from Child Safety would like to maybe fill in any gaps or provide some further information. So April's actually put quite a few resources in chat. I've just seen them all. It's got the SDQ link for the questionnaire. In addition, the templates that we have on the health pathway are all age specific. So if you went into the comprehensive assessments, they'd literally be from 0 to 12. They're basically broken down by age. So it's a very, it is very comprehensive. The other thing is the HEADS screening is built into the comprehensive health assessment template. And April's also provided, thank you, April, our website details, so Darling Downs, Westmorton, PHN, and then you basically get onto the services map, and there are a large number of services for mental health for young people. And the ECEI partner for Toowoomba is Uniting Care. So she's provided, thank you for that, April. And also, just to remember that under 5s, is it a 6-monthly review of the health plan and assessment rather than annually?
Okay.
So I've just, are there any other questions? I'm happy for everyone to unmute. And I suppose I also just want to share that in addition to the fact that we want these children to get this early intervention in Westmorton, we're currently running a project in collaboration with Child Safety and under the guidance of April as well. A similar project is being run at the Gold Coast. Are those the only 2 sites, April?
No, it's a statewide project. So every primary health network, which is there's 7 across Queensland, are also delivering a place-based response with the local Child Safety Service Centre. So
I guess with our project, the other aspects that we have included is Child Safety will send a secure email to the GP to provide some clinical handover information if they have it available, and they're working really hard to have a completed health passport. So we're trying to do that, and then the idea is once the plan is generated for early intervention, that is then shared with Child Safety by that secure email or post, or and definitely put up on My Health Record. And April, correct me if I'm wrong, but every child who goes into care in Queensland has a My Health Record?
Yeah, that's right.
So even if you see the child for an acute condition, I guess, Jane, you could also put that into an event summary and share that. And then that is available if the child crosses borders. That's also available to any of the basically nationwide. So I think what we're hoping is that children don't fall through the cracks. The other thing that I just saw, and I'll stop talking now, but I saw a report called Mind the Gap, where they've looking at the impact of COVID on various health, on various populations, and they've actually identified that children in out-of-home care have particular risk of poor health outcomes because of COVID. So we've even, and they're talking about 10, 20, so generational impact because of COVID. So I think as general practitioners, there's almost a sense of urgency to get the assessment, a health assessment done and the plan shared with Child Safety, who is really, even though parental consent is what we require when a child is on that interim order, the guardian is the state. So this child has had, and the goal, I guess, Jane, is always reunification with the family. However, we need to understand the context as well. These children have been put into the guardianship of the state because of the environment in which they found themselves, unfortunately.
And there's a comment from Elise saying that the carer will come with a letter which will explain information about questions about custody, guardianship and decision making. So when the family turns up, there'll be information with them.
I guess from the primary healthcare network perspective, we are building a resource, an online resource on our website, similar to what Gold Coast has. We have health pathways. This video will be on our website as a recording. And in addition, we're putting together a booklet to help carers and the young person and general practitioners understand their role. There are many, and again, I have to say, Jane, you've worked in the space for a while. I've had, some contact, but the learning curve for me has been how how multiple touch points that these children have, and navigating, you know, the system while really ensuring that they get better health care is hard and complex. But I think as general practitioners, we are very well placed to see them recurrently, but also to provide that clinical handover so that if they have to move, we can provide that context, that management plan to the next clinician. There's a few more comments. Denise has said if the child does not have a Medicaid card, that shouldn't hold things up. I mean, as GPs, we generally put those on hold, or we await that information. And also Elise has said if they don't have a Medicaid card, the department are more than happy to pay for the full appointment if required. So, you know, that should not be a barrier for these children accessing care. April also says that other options with the Medicare number, there's actually a AMA has done billings basically for newborn babies, that, you know, that there's an actual pathway for that. Am I right, April, or am I paraphrasing?
Yeah, the website just lists a whole heap of different options when the baby, which I assume could be any child without registration for Medicare. So there's a few options there based on the preference of the general practice.
Hi, Tanisha, it's Krista Kino here. Just saying that we do have sometimes issues in regards to registering birth records, which is the prequel to getting the Medicare card. But that shouldn't hold up anything, as again, where we are fully able to pay for a full assessment and things. Because, as I said, registration of births can sometimes be complicated.
Yep, thank you for that, Chris. Jane, I suppose I've been listening to your presentation, and the key messages that I got out are the context. And as GPs, I think our tertiary health colleagues see us as the context specialists. But I think that sometimes in general practice, when we see a child coming in with a foster carer, we just see them as another child rather than taking on the context that these children in out-of-home care find themselves, you know, the background. So I suppose the key messages for me were the context. We definitely know these children have trauma and possibly some medical issues that have been missed. We know from what you've said that early intervention works, so we really need to get that plan in place and get as much services to wrap around this child. Because the child is in out-of-home care, even though parental consent is ideal and wanted, the custodian or the guardian for this child is actually child safety, and therefore there shouldn't be a barrier to sharing information with child safety. And that I think the other thing that you made a very good point about is actually follow-up and recall. And in fact, that maybe we need to, I like the idea of putting a warning in the warning section. We all have that in our practice software to, you know, highlight that the child is in out-of-home care, but then also to maybe amend our recall system so that we can do that follow-up and that child safety is actually included in that recall mechanism. Is there anything else? I mean, anyone else could maybe jump in terms of, those are the things that I guess I've learned from the presentation. There we go, we've got somebody, Elise. Oh, I think Elise said her mic's not working, but she has unmuted. We can't hear you, Elise, sorry. Okay, so if there aren't any other questions, are there any final comments from you, Jane or April, being our panel today?
Not from me.
April, from your side?
I think it was very thorough, so very much appreciated for putting it together. I think it shows a great opportunity to share this across the state.
So if there aren't any more questions, I'll close the meeting, and we've got 14 minutes back in your day, which is great.
Oh, there's another comment by Elise.
Elise has said, if there's a concern about the child changing foster carers or child safety officers, even if the child changes placements, child safety officers putting the child safety officer down as Ipswich North Child Safety,
Yep.
they will ensure that the information is passed on.
Excellent.
And I suppose all that's left is to say thank you so much to Jane for taking the time to give us this very informative presentation. I'm looking forward to seeing your Health Pathways live. I think that should happen in the next few days. And I'd like to thank everyone online for staying and for participating. There was another question. Can these services be activated should they present in ED? Absolutely. Are you talking about if you're talking about the PHN services, Mario? Yes. So as long as some of the services do require mental health treatment plans, so if that can be put in place, then the services can be accessed. There are some non-clinical services such as care coordination that can be accessed without a mental health treatment plan, but that is all on our website, and you're welcome to contact me. Okay, so thank you everybody for your time. Thank you, Jane. Thanks, April, for all your expertise in this area. I'm really passionate about this space, and I'm hoping that we can start making a difference in these children's lives in Westmoreton and Darling Downs. And I'd really like to thank everyone for attending and for your time.
Thanks, Anita.
Okay.
Well done. Thank you.
Thank you.